right. So if you have read and understood, considering the critical care scenario, kindly tell me what are the nutritional options available for this patient?
Total parental nutrition
Okay. Why?
or enteral nutrition.
Yes. All right. Once you talk about enteral nutrition, what are the options available that can be offered to the patient?
For enteral?
For enteral, yes.
Yes, it can be oral intake, or
Yes.
it can be through nasogastric tube or
Yes.
nasogastomy,
Yes.
and also percutaneous endoscopic gastrostomy and percutaneous endoscopic jejunostomy.
Yes. Okay. Can you tell me, you said TPN, total parental nutrition. What are the routes of administration of TPN?
It can be through central line or peripherally inserted.
All right. How do you decide which route to be offered to this patient?
This patient looks like would like to go for total parental nutrition.
Yes. Which route would you prefer?
Central.
Central. Why?
Because this patient will need thick fluid, which cause the irritation of the small blood vessels.
Very good. Okay, once you have to consider for the nutrition of the patient, what are the things that you should keep in your mind?
Sorry, can you say that again?
Yes, once you have to consider the nutritional options for this patient, what are the complications that you should keep in your mind?
A complication of doctor, okay, it can be lead to sepsis of the line and infections of the tube, or it can be due to obstruction,
yes,
or displacement or migration,
yes,
or it can be due to wound infection and fistula,
yes,
and also it can meet metabolic change such as the hyperchromic metabolic acidosis.
Okay. What about refeeding syndrome? Can you define the term?
Yes,
that is
refeeding
also
syndrome.
Yes.
This is fatal. It's a fatal. It's a fatal fluid and electrolyte shift,
yes,
which lead to most likely potentially hypophosphatemia and
right.
hyponatremia.
What are the types of refeeding syndrome that occur? Okay, how would you know patient is suffering from refeeding syndrome? What are the clinical features that you should look out for?
A patient would like present with nausea, vomiting, and abdominal pain.
Yes.
And also laboratory will be the hallmark is hypophosphatemia, and also will be hypokalemia and hypomagnesemia and hyponatremia.
Okay, how do you calculate how much nutrition to be given?
For the normal person, it's most likely 30 kilogram per day.
Yes, yes.
For this patient is critically ill patient, so yes. I will
and
go for
post-operative as well. Yes.
Yes, from 30 to 35 kilocalories per gram per day.
Kilocalories per kg. Okay. How is it increased if a patient presents with fever? How would you increase it?
It is increased by 10%.
Yes. Okay. Can you please tell me what are the complications or why eternal nutrition is better than TPN? What are the advantages?
Because it is safe and easier, and also there is no mucosal atrophy.
Yes.
And few complications.
Cheaper as well. Okay, can you please tell me what are the constituents of total parental nutrition, TPN?
It's composed of water and fluid and electrolyte, and also carbohydrate and protein.
Yes.
Vitamins such as vitamin A and D and E and K, also vitamin B and C, and also electrolytes such as sodium and potassium, magnesium and calcium and phosphate and chloride, and also contain nitrogen and hypertonic solutions.
How would you assess the nutritional status of the patient?
By history and anthropometric and dynamometric measurement, and also LFT and albumin level.
Yes. Okay. What are the signs of malnutrition? How would you know if patient is malnourished?
There will be the poor wound healing.
Yes.
And also if it increase infections and sepsis.
The albumin level will be low. And
yes, decrease the albumin level and hyperkalemia and metabolic acidosis.
Okay, can you tell me what are the types of electrolytes which are present in total parenteral nutrition?
There is sodium, potassium, and calcium, and chloride, and magnesium.
Okay. Can you tell me how this leads to bowel mucosal atrophy?
Okay. The presence of enteral feeding, which lead to release of enzymes and hormones.
Local hormones, yes.
Local hormones due to stimulus of fluid, which lead to release of enzymes which prevent the mucosal atrophy.
All right. Yes. What is the main source of carbohydrate in TPN, total parenteral nutrition?
Fat and sugar.
Glucose. Okay. Can you tell me what are the disadvantages of giving or glucose or having glucose as the main source of energy?
This will lead to respiratory failure due to oxidation of the glucose, which lead to production of more carbon dioxide and lead to respiratory failure, and also lead to fatty liver due to the glucose is converted to lipid in the liver, and also glucose intolerance because it's the only source of energy that is utilized.
All right. Can you tell me how would you define glucose? Or how would you define, okay, glucose or dextrose?
Glucose, this is the symbol
sugar.
This is simple sugars composed of carbohydrate CHO and can use as food product or sweetener.
Can you tell me a few indications when TPN can be given, total parenteral nutrition can be given or should be given?
In anorexia and increase of the catabolic state such as severe pain and multiple trauma and head injury, and also some gut problems such as paralytic ileus, and also crown and short bowel and paralytic ileus and radiation enteritis.
Good. Okay, good.
Very good.
I'm happy today. Really enjoyed. It was very thoroughly prepared. Can you comment on the X-ray that you're looking at? This red arrow points at what?
This is abdominal X-ray showing coin appearance.
Yes.
So just in small bowel obstruction and dilatation.
Yes. Typical of
Crohn's disease.
Yes, very good. Good, thank you.